Indeed, it's just gone 6 o'clock across the capital. Sachelle here for 1 hour because we are interrupting another drive time show. This is our monthly 1 hour panel show in conjunction with Brent Health Matters. This is where we talk about topics that are really important to our community. And we've got a very amazing panel of guests that I'm really excited to introduce to you. But before all of that, if you do want to get involved in the conversation, or you do want to get in touch, or you have any questions that you want to put to our panel, please hit us up on the socials at the Beat 1036 FM on Facebook, Instagram, and Twitter. There will be a load of resources and a lot of information coming your way for the next hour. So please make sure that if you've got your questions, you do get in touch, and we will make sure we pass them on to our fantastic panel. So without further ado, let's get into the program tonight. And we are going to be talking about winter planning because, of course, as you know, Christmas is coming. We are officially into the winter months, so you know our health is more important than ever as we are coming through these cold seasons. And I just want to introduce the panel. So I'm going to start off by letting you know who we've got today. Pippa, I've got Pippa Nightingale here. Pippa, are you there? Can you hear me?
I can hear you.
Pippa, can you hear me? Are you there?
I can hear you. Can you hear me?
Hello. How are you?
I'm very good, thank you.
Thank you for joining us today. Can you just let us know a little bit about what you do and how long you've been in the industry?
Yes, so my name's Pippa Nightingale. I'm the Chief Executive of London North West Trust. So that's 3 hospitals. It's a hospital at Northwick Park, hospital at Central Middlesex, and a hospital at Ealing. And I run the organisations. I've been in the NHS for, I don't know if I dare tell you, many years now. I started off as a midwife, and I've worked clinically for a lot of my career, and then ended up in health management. So yeah, it's great to be with you all.
Fantastic. Thank you for joining us today. I will come to you with some questions because I've got loads of things that I just want to find out from you, as I'm sure do our listeners. So I will come back to you. Thank you for joining us. I've also got Jenny Laniero. Are you there? Can you hear me?
Hello, Sachelle. Good evening. Yes, I can hear you.
Thank you for joining us. How are you this evening?
Very well, thank you.
And for those that don't know you, can you tell me a little bit about what you do and how long you've been in the industry, please?
So I'm a mental health nurse by trade. I've been mental health nursing for about 15 years now. And I currently work as the operational team manager for a team called the Brand Health Inequalities Team. I work for Central and Northwest London NHS Foundation Trust, which is a mental health trust that looks after Brent. I am also the clinical lead for the Brent Health Matters program in terms of mental health. The Brent Health Matters program works with residents of Brent to reduce inequalities, and we are the mental health strand of that program.
I love that. Thank you so much for joining us. I've got some questions for you as well. I will come back to you. We've also got Dr. Mohammed Haidar. Are you there? Can you hear me?
Yes, I am here.
Hello.
Hello. Hi. Good evening. Thank you for having us on this
show.
Thank
you. Thank you for joining us. You know, these conversations are so important, and we really think that our listeners and the community need to come together and have these conversations because they are very, very important. Can you tell me a little bit about what you do and how long you've been in the industry, please?
Good. I'm a Borough Medical Director and Integrated Care Partnership Clinical Lead. I'm a Brent resident and I'm a Brent GP. I've been in the industry, well, you're going to get the secret now. So I've been there for many, many years, over 30 years. I've been a hospital for about 8 years. In the last 20 years, I'm working as a local GP. So that's me. And by the background, I've always been around Brent, and I used to live in the St. Raphael's Estate in Brent, so very in the heart of Brent, and currently working as a GP within the area and trying to look after our residents. And also my other title is I'm the co-chair of the Health and Wellbeing Board, and also co-chairing the Health and Equality, which in our diverse borough is a major thing that we need to tackle as well. So that's me in a nutshell.
In a nutshell. Thank you so much for joining us this evening. I will come to you with some questions as well. We've got Marsha here. Marsha, are you there? You're a pharmacist, aren't you? Can you tell me a little bit more? Marsha, are you there? Can you hear me?
I am here. Sorry, trying to unmute. How can I follow Dr. Haidar? Goodness gracious, my CV is very simple. I'm a community pharmacist and have been for very, very many years. I am also representing community pharmacy. on behalf of the Brent and Harrow Local Pharmaceutical Committee, and we help to support the community pharmacy NHS services that many of you hopefully will have accessed at some point in the past, and we hope lots of you will access in the future.
Fantastic. Thank you for joining us. I will come back to you as well. And Christine, last but definitely not least, are you there? Can you hear me? Christine, can you hear me?
Christine is here and she can hear you.
Oh,
I'm Christine
fantastic.
Wellington, and I have the pleasure of working with the charity sector in Brent. That's voluntary, community and social enterprise organisations. We're known as the not-for-profit sector, but it doesn't mean that we're free or we just rely on volunteers, but we work to build stronger communities, and we've got a very active health and community sector in Brent. So I'm looking forward to sharing a bit more insight to the role of organisations that work with residents that are considered need to reach, sometimes known as hard to reach, but we say need to reach.
Yes, fantastic. Thank you so much. Christine, I will come back to you. I just want to start with you, Jenny, if you don't mind, because we're talking about winter planning, and we're talking about how you kind of prepare and look after yourself and make sure that, you know, you're doing the best thing that you can do to make sure that yourself and everybody else is looked after and kept safe over the winter months. But I just want to start with you, Jenny, because I'm just wondering, you know, if there's someone that's feeling, you know, like they're stressed or they're anxious, because of course, when winter comes, people do tend to feel a lot more pressure. They do tend to get a lot sicker. You know, where do you suggest they go, first of all?
That's a very good question, Sashel, and also very understandable around these times of the year, and also in the current climate with the cost of living. You know, crisis that we've been going through for some time, but even much more so during the winter months, where people are really actually choosing whether they should eat or heat. Yeah. So things are really tough for people, and I recognize that. And there are luckily some initiatives across the country, nationally, as well as in Brent, you know, like the warm spaces initiatives. So these are places where people can go. It might be a library, it might be a place of worship, it might be a food bank, it might be, you know, a cinema or somewhere like that. These are some of the places that people can generally go. But if you were feeling low in mood, you were struggling with anxiety, you were struggling with some worries, that we have our local talking therapy services. So the first point of contact is obviously usually someone like Dr. Hader, your GP, your local GP. Yes. It's the first person to go and speak to about any, you know, difficulties with your mood, and they would know who to refer you to. And within our local therapy services, obviously there would be professionals who will be able to support people around low mood, around anxiety, around depression, around worries that they might be experiencing. But not to pathologize and say that all worries are related to something clinical. So it could be just a very normal experience that anyone is having. And this is also where our voluntary sector partners come in, and they're also able to support people that might be, you know, experiencing low mood. I personally, you know, also run a warm space as part of a faith group. I work with people who might be experiencing homelessness as well. We have, you know, soup kitchens or places where people can go in Brent and have a hot meal at least 4 days per week that we normally signpost people to. So there are initiatives and opportunities available for people to access. And usually as my team, as the Brent Health Matters program are out and about, we promote these places. We put them on newsletters as well, and we try and share them through all our networks so that it can reach people. And as Christine was mentioning, need to reach or yet to reach communities who might not usually be aware of this. So we do outreach and we share this information as much as possible, but also about looking after your health. You know, in the winter months, people might experience what we call seasonal affective disorder, when, you know, the months are colder, get darker, you know, you leave in the house, it's dark, you're coming back, it's dark, and it's not great for anyone's mood. And you don't have to have a diagnosis to experience that. I experience that myself, but I kind of, you know, go for a walk, you know, There's like a sports in minds where they offer free exercise classes and groups and yoga and Zumba. So there's lots of initiatives around where people can go somewhere, be warm, be included, look after your health, and just, you know, not even think about the cost at that. So there's lots of initiatives around, and I might not be able to kind of reel them off at you as we speak, but these are also things that I can share with you that you can perhaps put out.
Amazing.
You know, to your listeners.
Thank you so much. And Dr. Hader, I'm going to come to you next, just because Jenny mentioned the first point of call going to your GP. But just before that, what if there was someone, Jenny, that was kind of managing their own mental health symptoms, but during the winter months they had a crisis? What do they do then? What would you suggest? I know you said go to the GP, but is that what you would recommend as first point of call at all times?
I mean, Dr. Hader wants to answer, but we do have our community crisis support system. So it doesn't have to be even our home treatment team and crisis teams, but actually we have something called Hestia Coves, and they're based in Stonebridge at the hub in Stonebridge. They're open every day from 2 p.m. until 10 p.m. at night. So again, people can go in there, have a chat with somebody who will be able to understand the crisis that they're going through and support them, have a hot drink and just kind of talk things through. And then they will also link in with the mental health team if it was really something serious.
I love that. Thank you so much, Jenny. Dr. Mohammed, did you want to add to that?
I think just absolutely, I just echo what has been said, but to add, if someone is feeling stressed, low, anxious, reaching out to GP will be the first thing you do. I think that's the traditional thing that you go. And the step toward that is either you need to call the GP, book an appointment, but also I need to reiterate there's other new systems available as online appointments. You can go to the website and this will be giving you the initial assessment opportunity that you make an appointment. That as a GP, as a local GP, if somebody's in this situation, of course, it's my duty of care to look after them. We will start with during the appointment with initial assessment, obviously, and patient will need to share their symptoms, be honest about how they feel so we can help them, we can take this further for them. After taking the medical history, it could be a GP, could be a health professional, and we do jointly decide on the patient care and whether we need to organize, as Jenny's mentioned, about agreeing on a plan of action, what we need to do. Either we will advise them and within our ability as general practitioner, guide them, advise them, treat them. Depending on the severity of their symptom as a GP, we might refer to our mental health professional colleagues, such as psychologists, psychiatrists, or counselors, or maybe some of the voluntary services, which might be helping. Do they need a prescription? Do they need medication as GPs will prescribe? Do they need any stronger medication? Then our mental health team will support us and guide us to see what they need. GPs usually also will make sure that there is a continuity of care. We offer them a follow-up appointment and then sometimes agree with the mental health care planning. But the main thing is for our residents in Brent to remember it is very important to seek help. We are here to help. We are the health and social care service. If you're struggling emotionally, then GPs are here to help. Health services are here to guide you. There's websites, there are voluntary services. I think, Jenny, you covered it very well. Yeah. One thing I wanted to add about your initial question about the winter pressure and winter month and thing, the main thing is that prevention is the main thing. So in addition to having our hot places and thing in Brent, the beauty of the integrated care partnership is that we work as one team now. So it's not in silos, the health is separate, social care is different, local authority is different, and so on. As a system, we also offer prevention, like I would encourage our residents to go and get them vaccinated against flu. Anybody over age of 65 should have a flu jab. Anybody who's under 65 who are at risk, we would encourage them to get themselves protected. So once you have these protective measures and immunization, vaccination, I think you already done a big job to protect yourself.
You're starting to work towards it. Yeah, and we will come to vaccinations and immunizations. We definitely will touch on that.
I hope that helps. Thank you.
No, that's okay. That's okay. But you know, you were saying that people should kind of make an appointment with you, a first point of call, Dr. Mohammed. You know, what about those people that kind of struggle to make an appointment because they maybe work long hours or they're carers of somebody who's vulnerable at home? What would you suggest they do?
I think if our residents or patients are struggling and having difficulty making an appointment with the GP during a normal working hours, or if they have commitments, as you mentioned, their caregiving responsibilities that does not allow them to be able to present themselves, there are several alternative options accessing the GP support. Out of our clinics are available. All Brent GP practices offer extended hours. We have core hours from 8 a.m. till 6:30 p.m. But there is also from 6:30 p.m. till 8 in the next day we have services. But GP extended hubs work from 6:30 till 8 p.m. That's extended in addition
Right.
to GP core hours from Monday to Friday. We also have a Saturday clinic from 9 to 5 p.m., 9 a.m. to 5 p.m. Access to Hub is by appointments. Either you register with the GP and tell them, or you can call NHS 111 and say you need an appointment, you need help. They will directly to the urgent care centers, they directly to the hubs, and you get an appointment streamlined to whatever your need will be. We also, in addition to urgent care centers, we have walk-in clinics available where people can walk in and get the treatment that they need. But I would encourage nowadays with all the service of internet and accessibility, online appointment booking systems, we have e-consultation where it could answer some of your queries and maybe guiding you to the right treatment, and also encourage our people to utilize the online health platforms in the NHS app. NHS app is
Yeah.
a very, very useful tool. People could download this and use that. That will guide them to the right thing. And I think that is another way of just accessing the services. And remember to communicate with your GP on the first instance that you're a carer. If you're a carer, we will put them on the system as an alert and register them as a carer. And in that situation, they get a priority anyway. So
Right.
that will,
Okay.
the help will be directed to them in a
Yeah.
way that it should. Thank you.
Okay, fantastic. And you did mention call 111. How does someone know whether they call 111, 999, what service they should use?
I think it's quite important to decide what service you need. And if you look as a lay person, I look at my own elderly relative and things. For them it would be difficult if they're on their own and decide who to call. I think contact your GP on the first instance. If you can't get them, then you can also probably the GPs should have if you have a non-emergency health concern, if you have a routine checkup you need, if you need management of your long-term conditions, if you want a prescription refill, if you want minor, some of the illnesses you want to be dealt with, or you want to access a scheduled appointment with your GP to discuss something personal, that's the way you should call GP. But if you can't
Right.
do that, then NHS 111 is another urgent medical concern you have. You can always call them. And how to access and dial 111, it's very easy. Dial 111. You will get access to a trained healthcare professional who can provide advice and direct you to the right discipline, to the right
Yeah.
service, for the right reason. Obviously, we all know that 999 has been really overwhelmed with the number of calls. That's why the 111 was put in the service. But I would like to mention that you use 999 for life-threatening emergencies, for severe injuries, for chest pains, for difficulty in breathing, for loss of consciousness, for some severe allergic reaction, for major accidents. And these are the kind of things that can't wait. We need to get help straight away and immediately.
Yeah.
And how to access and dial immediately 999, either the phone that you'll always, now the system is so evolving, but the paramedics will answer your call, they will direct you to the emergency services, there is different services that can attend to you. But the main thing, the essential answer is the guideline for choosing which service is available on website. I reiterate, use GP for non-urgent, routine, ongoing health care needs. And if your conditions are not an emergency, if you can wait for the appointment, or even the same day on urgent appointment, also use the GP. If you can't get that, call 111. And these are for urgent, non-emergency, and call 999 for emergencies as a thing for critical situation where the immediate medical attention is required. And that way we can use our system in a beautiful way, so we're not overrun one against the other. But we are all a health service. We are here for you. We are here to provide you with the support you need.
I love that. Thank you so much. Thank you for all of those options that people can do. But one thing that I do want to talk a little bit about is you've listed off a whole load of ways that people can get in touch with the healthcare system and get some help and support. But I know a lot of people might not know that actually you can go to your local pharmacist as well. Marsha, can I just bring you in for a moment, just to talk about this? Because, you know, what kind of services does the local pharmacy offer to kind of help patients, especially during the winter months?
We offer a full range of services for non-critical, obviously non-urgent conditions. We're there for well people to maintain a healthy lifestyle. We can give lots of healthy living advice, but we can help those who are obviously not seriously ill, helping them to get better. Maybe somebody would just need advice. Dr. Hader rightly says contact 111, which is fantastic. Quite often when people use the NHS app, it may actually suggest that rather than going to a GP or going to urgent care, and certainly A&E only in the most serious of cases, you can actually go and see your community pharmacist. We are one of the only healthcare providers, probably the only healthcare provider, which does not operate generally an appointment system. You can walk in off the street, you can get advice. A pharmacist should be present all the time. We are highly qualified healthcare professionals. We do a long training to get to where we are. And our counter assistants are also trained or working towards healthcare training. So if you come into a pharmacy, you are assured of getting good healthcare advice. And if we do have concerns, if there are any red flags, we see something that we're not sure about, we will signpost a patient to another service. We would then perhaps suggest 111 or going to see a GP, or suggest somebody goes to A&E in the more severe of cases.
Serious, yeah, but it's still an option, and I think it's quite important. I do want to unpack this just for a minute, because a lot of people, including myself until recently, didn't know that you can actually go to your local pharmacist and you can get some advice and you can get some support in that way. You mentioned qualifications, because some people might think, well, how is a pharmacist qualified to give that kind of advice and support? What qualifications do pharmacists tend to have?
Yeah, a pharmacist working in a community pharmacy needs to undergo a 4-year master's degree just to start with, just to have entry into becoming a community pharmacist. And then there's a training program beyond that where they have to do a period of registration, either in a community pharmacy, GP practice, hospital, or a combination. Some people go into industry as well. But there is a period, a minimum of a year, practical experience, and an exam at the end of that, which they have to pass, and it's not easy to pass. Following that, there are continuing professional development courses. We have to go through reaccreditation every year. We have to be registered with the General Pharmaceutical Council. So we are fully qualified. We are members of the healthcare team. We are sometimes considered as part of the primary care team, but we sit on the high street. We're called community pharmacies for a reason. We are there in the heart of your community, and we see everybody. We say make every contact count, and for community pharmacists, we see people, even if they just come in for a chat. We like to think of ourselves as the community aunties and uncles.
Oh, amazing.
For those people who don't have necessarily a support network. In Brent, we have a very diverse community, and not everybody has family members around them to support them. And we have fantastic networks in Brent to help support our patients, and healthy people too, who just may need a little bit of help from time to time for various reasons. But we have this open door policy in community pharmacy. So somebody can come in and just have a chat, and we're very good at signposting you to the right healthcare provider or organisation that may help with your needs, or maybe just an ear, somebody to listen.
It's that easy to just go and see a pharmacist.
Just walk in. We do lots of services as well. So there's something called the Community Pharmacy Consultation Service, and patients can be offered an appointment either from participating GPs or from 111. some A&Es. I'm not sure if the local hospitals are up and running with that as yet, but there are lots of new consultation services for community pharmacy where patients can very often get an appointment at a time that is more suitable for them, because we're generally open long hours. There are many pharmacies dotted around that are open till late in the evenings, open Saturdays and Sundays. Brent is very well served with its pharmacies. We do blood pressure checks, we do healthy living checks for people. There's contraception services. There's a whole wealth of services out there that patients can access. Not all pharmacies may offer the same services as yet, but the range is improving. And if anybody is interested, then please contact your local pharmacies. You can get their details on their websites, or through the NHS website, and find out what your local pharmacies do.
What
and
they
get
offer,
to know, get to know them.
I love
We
that.
love our customers, we love our patients, we love people just popping in saying hello, and we like building a relationship.
I love that. I think Dr. Mohammed, you wanted to add something. So I will
I
come to you. Sorry, go on.
I'll wait. I just wanted to add, as a pharmacy supervisor, echo what Marsha mentioned. And I think it's quite confidently patient go and see these health professionals, which has been really trained very robustly, and then have the postgraduate training. And I'm a supervisor training in minor ailments. And Pepper might add, there's a good new services coming as a system. We're trying to help patients to have more access. While previously you went to a pharmacist, you couldn't get a prescription for a minor ailment, for sore throat or a skin infection or something. Now the pharmacy will be able to help you probably from 1st of December or very soon. I think Marsha said it's not yet, but it's on the way to be able to help the patient to pass the hurdle and be able to get the medication without going back to the GP to get a prescription.
Right, yes, amazing.
So there's a lot of innovation on the way to come in. And our pharmacists are very, very geared up and trained for this. Thank you.
I love that. Pippa, I'm going to come to you next, but just quickly, Marsha, just a quick one. Of course, during the winter months, there's been a whole load of, an increase in patients that have got cold-related illnesses, etc., etc. I myself have been receiving text messages saying, do you want to get your vaccination? Why do you think that it's important that people can get some vaccinations, especially in pharmacies? Why do you think it's important they can do that?
Yes, if people aren't aware, then you can get flu vaccinations from pharmacies. Most pharmacies will offer flu vaccinations. They're free for certain eligible cohorts, which I won't go into here, but you can look those up on the NHS website. But a lot of people will be covered to have free flu vaccinations in pharmacies. Or if they don't fall into the cohorts, they can pay. They're not hugely expensive, but that is another option, usually under £10, to protect themselves against flu. And some pharmacies will also offer the COVID vaccination too. Some pharmacies as walk-ins, some need to book. That you would need to check. But we're open, again, long hours. Most pharmacies do operate, certainly for flu vaccination, a walk-in service. So if you're walking past and you've got a few minutes to spare, you can pop in. Generally, there aren't long queues. It's an easy process. For community pharmacy, we try and make access to healthcare as easy as possible. And if we're not able to help you, then we will try and signpost you to somebody who can.
Exactly.
And I'll just add, if I can, while I've got the opportunity on immunisations, is for all parents to consider having their children vaccinated. That is so important, as we're seeing outbreaks of measles and other notifiable illnesses at the moment, just because the level of vaccination has dropped, and we're seeing some very sick children out there. And the knock-on effect is then to see adults falling ill, or those perhaps who didn't have the opportunity to have their vaccinations at a very early age and would possibly benefit from having their vaccinations now. But that would need to be done through the GP.
Thank you for that. Pippa, I want to come to you quickly, if that's okay. We're on the topic of vaccinations. Marsha did just mention a little aside there, which is very important for our listeners to hear. I want to talk about seasonal vaccinations with you. Can you just give me a little bit of an insight into what seasonal vaccinations are and why they're important?
Yeah, absolutely. So, I'm thinking of this from providing hospital care, and actually what we're seeing is many patients needing to come to hospital because they have viral illnesses, and that's both adults and children. So what Marsha says is really important. What we've got in the back of COVID is children that missed their vaccinations, and it's really important parents take them to be vaccinated. We are seeing more and more children with diseases that we haven't seen for a long time, such as measles, and they are really sick. So it's really important, and then preventative vaccines are given. They're not seasonal, but they are preventing these diseases that will last in a child for life. There is then seasonal vaccines, which is the COVID and flu vaccinations. These are still really important. I think there is this slight tendency now in the population that they've become almost vaccine exhausted, because we have offered a lot of vaccines, and it's actually become quite confusing, I think, for some populations, and there is still some vaccine hesitancy out there. We are still seeing people quite sick with flu, and we are still seeing people sick with COVID. It hasn't gone away. I think people like to think it's gone away. It hasn't gone away. It's a virus that will keep living, and it will keep mutating and changing, because that's what viruses do. Therefore, the seasonal vaccines are important, because that vaccine changes every year to adapt to the virus and how it's adapted. So what it will do is, if people get COVID or they get flu, they will not be as sick as they would have been if they hadn't been vaccinated. So it's really important to be vaccinated. The other thing I'd say, particularly with flu, but now COVID as well, is many people can have it and not know they've got it. So therefore, you're risking the elderly population, particularly around festive period times when you're going to visit families all being together, quite often older, vulnerable members of the family. We quite often see a few weeks after that some very sick, frail older people, and that's because they've got flu or COVID from family members that weren't vaccinated. So by being vaccinated, you're not just protecting yourself, you're protecting other people that you'll be with as well. So it is really important.
It is. Thank you very much. And is the other vaccinations open to everybody of all ages? Can you talk to me a little bit about that?
Yeah, Marsha might be best talking about that, but they are available to everybody. They are free for a large proportion of the population, particularly our vulnerable members and children that require vaccination. So, and like I say, the best place to go and access these for your seasonal vaccines is your local pharmacist. It's really easy. It's really simple. It's actually where I had my vaccine this year. You can walk in and have it. So it's the right place to go and have a conversation about any of the vaccines. If you're worried, I wouldn't sit at home worrying about it. I'd go and have a conversation with a pharmacist. If you're not sure whether to be vaccinated, go and have a conversation with a pharmacist who can tell you the facts. And there are so many misfacts and wrong information in the media. It's really important to talk to a health professional if you're not sure. But because there are many people that think they've had reactions to vaccines, and quite often they haven't had reactions to vaccines, and they should still be vaccinated. So go and have that conversation with a pharmacist or with your GP. And for childhood immunisations, it's the GP it provides them. So really important that through a health visitor or GP that you access them vaccinations.
Thank you. And what about screening programs, available screening programs? What about those?
Yeah, screening programs are really important, and we do feel like in the NHS we've gone backwards. So since COVID, many of the planned procedures were stopped, like screening programs, because actually all healthcare professionals were forced to do the urgent care, which was looking after really sick people, and the population were isolated. So therefore, many people have missed their screening opportunities, such as for cervical screening, so smear tests, breast screening. There are many screening programs that we cannot encourage you enough to participate in. So when you get that reminder, please take up that opportunity. We have seen an increase in particularly younger populations with cervical cancer or with breast cancers that could have been treated earlier and could have been picked up earlier if they'd have had their screening when they've been called for screening. So it's really important. The screening tests are there to prevent people needing to have intensive cancer treatment. So if any cancer can be detected early, it's very successful treatment outcomes. If it's left to progress within the body, it's very difficult to treat someone and less likely that someone will survive. So it cannot express how important it is to engage with screening programs to try and keep yourself well and prevent any disease.
I love that, Pippa. Thank you so much. I will come back to you. Christine, are you there? I just want to talk to you a little bit about the kind of voluntary and community sector, because we've heard from Dr. Mohammed, the GP. We've heard from Marsha, the pharmacist. Jenny is very knowledgeable about mental health and that kind of care. And of course, we've just spoken to Pippa. But I just want to know, what is the role of the voluntary and the community sector? Can you just talk to me a little bit about what you do there?
Shashel, it'll be a pleasure. So during the winter crisis, the first people at hand are likely to want to go to someone they know and trust. You're going to knock on a neighbour's door. So in most neighbourhoods, you may have a faith-based or a residence hall, and it's really important that those locally based organisations whose doors are often open at a time when maybe the main services are closed can be reached. So the voluntary and community sector are made up of those smaller, less well-known organisations on the national stage, but well known within their local patch, just like the pharmacist. That you've got local organisations you can go to, you've got local faith-based organisations. So you'll know that you've got after-school clubs, you've got lunch clubs for the elders, you've got play groups. There are so many small organisations, and when we bring those together, we call them the voluntary and community organisations. We do have in that household names such as Age UK, MenCap. So the charity sector, in a sense, is made up of those smaller, locally based organisations or cultural groups that get together, as well as those larger organisations. So in Brent, we're rich. We've got about 500 to 800 locally based organisations. And when it comes to a winter crisis, you have the choice. Jenny mentioned, is it heat or eat? Now, if you've chosen heat because it's winter, fortunately, we've got food banks and organisations who gather themselves together and coordinate food banks, hot meals for people on a regular basis. Another key activity of faith-based organisations. During the pandemic, we saw a rise in something called the mutual aids. So these are neighbours, people who lived in a neighbourhood, wanted to do something for other people, and they got together to address the crisis during the pandemic, offering food, picking up prescriptions, delivering parcels, taking dogs and animals for walks, etc. So there's a vibrant, Brent is rich in this vibrancy of charity sector. So when it comes to winter and the crisis, you often turn to your friends, your families, your neighbours, and within your neighbourhood, you'll go to trusted organisations. And those trusted organisations in Brent are often made up of local residents.
Right. Okay. Because there are some people, if you talk about, maybe going to the voluntary and the community sector, there are some kind of myths and misconceptions and misunderstandings and rumours when it comes to, approaching this kind of care. Have you come across any of those in your career?
Yeah. So people think that voluntary organisations are just voluntary. We're just full of volunteers. That's the biggest myth. It's just all volunteers. But like any industry, we need to pay for workers, pay for training. If you're delivering a service, you need to meet standards. So if you were in our clinical hospital setting, you need to meet safeguarding standards. The same thing applies in the community sector. It's just volunteers. They're just do-gooders. It's more than that. We also need to meet the Charity Commission's requirement, Companies House requirements. So all the regulators, all the regulatory requirements that are required, we support. Our organisation supports the organisations that work with residents to meet that.
I love that. Thank you so much. And just one more, just before I come back to you, Jenny. How would you say that if our listeners are kind of tuned in right now, they might be like, how can I get involved? How can I engage in these local organisations? What would you say to them?
So brilliant. So at the moment, we're doing a lot of work around improving health outcomes for what we call them need to reach. We call them underserved communities, we call the ethnic minority communities. So there's some members of the community that are more at risk than others during winter and at other times. And I say to anyone who's thinking about getting involved, do get involved. I've got a couple of great offers. We've got a huge awareness around cancer at the moment. In a lot of communities, they don't talk about cancer at all. People are affected by cancer, pass away, and other members of their household don't know about it. So we're trying to work with Macmillan right now to increase awareness of cancer. We're also trying to help on the agenda that most of my colleagues around the table are aware of is hypertension. We know there's a need to deal with diabetes, hypertension. So we're encouraging organisations to be aware, have conversations. Don't just work with the myths. Listen to the myths. Find out for yourself. What do you need to do to improve your family's health and well-being? How can you help your neighbours to understand the health issues that affect us in Brent more often?
I love that. It's about being educated, isn't it? It's about really understanding.
Don't our parents say prevention is better than
cure? Exactly. Yes.
So,
Dr. Mohammed touched on that earlier, which is the truth. Yeah.
Absolutely. So we have to just keep talking to each other, and I'd ask anyone to come and get involved. So if you want to get involved, we've got a community cancer project on right now, community cancer awareness project. Get involved, just give us a call at CVS Brent. The email address is support@cvsbrent.org.uk. And we work with our health colleagues. We're part of the health roadshows when they were being delivered throughout last year. The added feature that we found really works is some nice culturally appropriate food. So if we're working with a particular community, we'll ensure that we're engaging with them, and we really value culture, heritage and identity. So we know it's getting that education, but delivering that message in a way that we know it's going to be well received. So get involved in the new year. We've got some road shows, health road shows. We're going to include Zumba, lots of positive activities to get people thinking about health.
I love that. That's just what we need to get us through the winter months. Thank you, Christine. Really appreciate that. And just on the topic of community, Jenny, I want to come back to you quickly. I've heard of a term called community navigators. Can you tell me a little bit about them, what they are, what they do, and how can we get in touch with them if we need to?
Thank you, Sashel. Yes, the community navigators, various, I mean, it is could be a care navigator, it could be someone who works with one of the voluntary sector organizations, or it could be someone that we commission. So we have them across different sectors. So the ones that we specifically work with as the mental health team, we have Rethink Mental Illness, and they usually have care navigators for young people, for adults, and for older adults as well. So there will be various, so they help people to navigate activities and resources within the community, how they can be connected. So you could say even within the Brent Health Matters program, some of my community connectors, some of the, the people that we've employed from the community are community navigators, because these are people who have the knowledge of what is available within the community and they can signpost people to, but sometimes they also have the expertise from a clinical perspective as part of, their training, maybe that they'll also be able to do some of that work. So that might be people like from Rethink, so they might be able to do work around, how people can look after their mental health much more effectively rather than just being a signposting person.
Right.
We also now have them for people who might have autism. So it's like various specialties, or it could be a generic signposting person who will help people to navigate care and support in the community, so that they are working with you in the community rather than people needing to go into hospital. And again, just having so many more resources, having so many more knowledges. And sometimes that might include the language that they speak as well, because they speak a local community language. So they would be the best person to help someone navigate the system, within the community, and also help us. If we're in the hospital or if someone needed to go to hospital, they will help them go along with them and help them navigate how the hospital system works as well.
And what do you think, because we are talking about winter planning here, and mental health is such a big thing. Of course, we had World Mental Health Day not too long ago, but just generally mental health is such a big thing amongst people of all ages, not just young people, but young people, old people, anyone that's kind of going through something. And in winter, like, you know, we were saying earlier, it can cause that, you know, it can cause your mental health to kind of deteriorate just a little bit because of the nature of the season. Why do you think it's important for us to be having these conversations now?
I think it's really important, and it's very, very timely, and really pleased that we're having these conversations now, because these are conversations that we should have been having for a very, very long time. But more recently, with publicity, with people in, you know, in the public spaces speaking about their own mental health concerns, their own experiences, it's beginning to normalize. But also the work that we've been doing in the Brain Health Matter program in raising awareness and just normalizing mental health is an experience that anybody can have. It's okay to go through it, and there is help. And I think it is really, really important around these times where people are isolated, where, you know, the weather is not so good, you don't have those other open spaces that you might be able to go to. You don't really get to see people quite as much. So it's important to talk about this, to let people know that you're not on your own. There is help. You can have a group. There's what we now call peer support, where people with a similar experience can be the one that you talk to around what you're going through. So it doesn't need to be someone with a mental health training, because sometimes people don't really want to talk to a mental health professional like myself, but they might want to talk to somebody else who is experiencing the same thing, who they feel can understand them a little bit more and share that experience, and also share tips on how they can look after themselves, how they can cope, and that sort of thing. So it is very important to have these conversations now, because a lot of people are experiencing mental health issues, and that is fine. It's a perfectly normal thing considering what people have been through over the last 3 years. I hear more and more now, people are telling me, oh, there's an increase in mental health difficulties. I see people at the food bank. I definitely think this person struggling with their mental health. I see them in this place. And so as a result of it, my team and I will pitch up at a food bank, and while people are waiting for their food, you know, we'll have a conversation with them. We'll just introduce ourselves, make it known that we're available. You might not want to be able to talk to us right now, but, you know, we'll leave some information, get in touch with us, or we can come back next time. I hold one-to-one consultations in food banks. As I said, my staff do that at food banks. At any other events, I go to Crisis Skylight, which works with homeless people in we've developed a partnership with them where we go every quarter. My physical health counterparts will go and do some physical health checks for people who would not normally be able to go and have a health check. They're not registered with a GP. They don't have, you know, a place to stay. That, you know, they're moving from place to place. We'll bring those services to them.
Wow.
I'll go and do mental health consultations. My other colleagues will go and do physical health checks, and then we'll bring in another service. For instance, the last time we went there, we brought in the Terence Higgins Trust. They were able to do HIV testing on the spot. We're going again next week on the 7th, and I'll bring Hestia Coves along with me, because I've been signposting people to go there. But actually, if Hestia Coves come and talk to them directly, it's so much more relatable, and they'll say, actually, yeah, I can go here and I can go and talk to this person. Yeah, so I think it's about time we talk about mental health. I'm really pleased, and as you can see, I can't stop talking about it, because I cannot have it pushed at the back anymore. It needs to come to the forefront. There is no health without mental health. If your mental health is poor, your physical health is poor, you're not going to be able to work, you know, properly. You can't study. Your relationships are affected. So mental
your whole
health,
life.
Yeah, absolutely.
Exactly.
So we need to have the conversation.
Thank you so much, Jenny. Thank you. Appreciate that.
Pleasure.
Pippa, I just want to quickly come back to you, because if we're bringing it back to the winter months, you know, as we were saying, you know, sicknesses and illnesses, they become a lot more frequent. A lot of people are going to A&E. Sometimes they might have minor issues or minor problems that they need looking at, but they might go to A&E. You know, what do you think we can do to kind of not put pressure on our A&E service over the winter months?
Yeah, I mean, let's not pretend our services are very pressured. They are. And normally what happens is in summer, we have a quieter period, and we winter we're busier. Actually, what happens in summer, we've carried on being busy. And that's not a surprise, is it? Because we pretty much switched off healthcare for a good 18 months, 2 years while we managed COVID. So we're now seeing people that haven't accessed healthcare when they should. And we're also seeing a population that are behaving differently. They've got used to coming to an urgent care centre and they're happy to sit there and wait a long time to be seen. So what we need to do is just re-signpost people, re-educate people of how to access what actually is quite a complicated health system. So we can then just save the hospital emergency system for people that need it the most, so that when people are really sick or their relatives are really sick, they get the best healthcare when they need it as quickly as they need it. So everything we've said, so absolutely protect yourself is the first thing. Keep well, protect yourself, look after others. So it's going to what Jenny says and what Marsha says around use your pharmacist, use primary care, have a conversation before you go anywhere. So that's 111. So phone 111, you can speak to a nurse, you can speak to a doctor, you can have an appointment and be seen in a planned way. You don't have to come to an A&E department to be seen. So you should only come there when it is really an emergency, a life-threatening emergency. And that's when you need to come to an A&E department. There are also urgent care centres. So some people don't understand the difference. An urgent care centre sits within a hospital, and that is to see emergencies like broken legs, broken ankles. We quite often see them on a Saturday and Sunday when kids have been playing team sports and things. So that's where you come for that sort of emergency. But that shouldn't be where you're coming when you've got, you know, your sore throats or things that can be seen by a GP in a more planned way or through the GP emergency hubs. So we need to use every part of the health system properly. And if everybody used it properly, the system would not have delays. But because people are accessing unnecessarily to the urgent pathway, then actually it is clogging up the service. And that means that people that urgently need it can't always get it. We will send people away. So if people come to an urgent care centre, we will, and it's in an inappropriate attendance, we'll assess them, we'll make sure it's a safe thing to do, and then we'll tell them to make an appointment with their GP. Or we will signpost them to a pharmacy, or, you know, we will signpost to a different area. So it's not an automatic that you will be seen. Also, we need to bust the myth that if you call an ambulance and you come to an A&E by an ambulance, you'll be seen quicker. Absolutely, you won't. So paramedics will do the triage of a patient. They won't bring people in by ambulance if it's not necessary. And then when they come to hospital, we will assess every patient. So every patient is seen on the priority of their clinical need, not on how they attended. So just because you've come by ambulance, we quite often bring people by ambulance and then they wait in a waiting room to be seen because they're fit enough to wait in a waiting room. So please don't use an ambulance thinking that it will get you seen quicker, because that won't happen at all. Every patient is assessed appropriately. What we're trying to do this winter, so there's a lot of planning that has gone into winter. We know it will be pressured, so we've opened up additional beds where we can. Like I said, that we've opened up extra GP clinics so that people can be seen out of hours. We're working as a whole system to make sure people can access all parts of the system. So don't just rely on a hospital. And what is really important is we can still do people's elective operations. We've got people that I know many of these people listening will be frustrated because they may have been waiting for an elective operation like a knee replacement or a hip replacement. We need to make sure we can carry on doing that, as well as seeing patients that are urgently sick as well. And that's really important. And that's why we need everybody to use every part of the health system, be that pharmacists, be that primary care, GPs, and then hospital only when it's needed.
Yeah, okay, wicked. Thank you for that. That was really useful. And just before I kind of start wrapping up, I just want to know from you, Pippa, just in terms of the trust, what is the trust doing to kind of ease the pressure on hospitals? Are you working with councils or other partners or anyone else to kind of to combat this?
Yeah, we all work together. I mean, it's not a hospital on its own. I work very closely with primary care, with pharmacists, with social care, with mental health. We are all one health system, and we all work together to look at how we can provide care to patients in the best place, and that's not always a hospital. And as Jenny said, much of mental health is now done in a community setting, and that's better for patients. So we all need to work together to make that happen. And the voluntary sector are really important to us. So when we know we're discharging patients from hospital that might still need that extra support, might need help with their shopping, things like that. And that's where we link with the voluntary sector. So we do all come together as one system. And that's how we've planned our winter. I haven't planned it as a hospital. I've planned it with all of our partners in health, so we can provide the right care for our communities.
Amazing, thank you. Right, so I just want to quickly go round just before we start wrapping up. I'm going to go back to you, Dr. Mohammed. Just quickly, could you just give me one thing that you would like our listeners to take away in terms of planning for winter from a GP perspective? Is there one piece of advice you would give to our listeners?
I think I would advise them to get in touch with us, seek support. We're here to support. and also to look after themselves and get prepared and take these advices being given on board and use the NHS app, because a lot of the questions and information and guidance and pathways and directions will be there.
Amazing, thank you.
I think I
And
hope that.
sorry, say that again.
Use us when you need us. So we are always available to support. So that's what I would encourage.
I love that. That would be your takeaway message for our listeners. I love that. Thank you. Thank you, Dr. Mohammed.
Yes.
Marsha, our pharmacist, can you tell me what your takeaway would be? What would you tell our listeners?
Oh, gosh, so many. But I would say we are in the community. If you're not sure which healthcare organisation you want to go to, pop in or give us a call. But certainly pop in if it's not serious. And there's a really good chance that, in fact, there's a great possibility we'll be able to help you, so you won't need to go somewhere else, just with advice or with a product. Plan in advance for the winter, get your products in, vitamins, definitely. We can help you stay healthy, and we can help you if you're not seriously poorly. So we're there for all your healthcare needs, and children as well. Remember, we can help children of a very young age. We have the ability to help you. We know the pediatric conditions as well. And very often children will go off to other healthcare providers when we can help you to look after your children using the pharmacy.
Amazing. Marsha, thank you so much. Christine, I'm going to come to you next, if that's okay. Could you give me what your takeaway would be from the kind of VCS perspective, just in terms of winter planning and how to kind of keep yourselves healthy, if you like?
100%. There's so much support that's available to residents. So my big takeaway is think family and safety. So people often think, and I'm really glad that my pharmacist colleague mentioned it, they think about maybe one member of the household, but there's a whole family. We need to think whole families.
Right.
So when you're thinking about that elder, think about the young children in the household as well. So think family in terms of the broad perspective.
I love that.
But the takeaway is stay curious and stay safe. So we talk about this one concept as colleagues. Safeguarding is everybody's responsibility. During the winter months, people are more challenged. You make assumptions that, oh, that person's got a grandma, that grandma has got a regular son or daughter that visit. Things change during the winter months, especially as we approach the Christmas season and the end of the season. So I talk about think safety. So the voluntary sector can be trusted because they all have to meet safeguarding compliance requirements, whether they work with adults or children, and that includes volunteers working alone. So excellent. Think safety, think family.
Thank you. Right, Jenny, we don't have long. We've got just over a minute. Can I just get one very quick takeaway from you, from your perspective?
Your mind matters. Seek help.
Oh, fantastic. Look at that. Pippa, have you got a very quick one as well?
I'd go along the same. Your health matters, so do all you can to keep yourself well. Preventative health is far more beneficial.
Amazing. Thank you, Pippa. Pippa Nightingale, Dr. Mohammed Haidar, Jenny Laniero, Marsha, and Christine, thank you so much for coming on today and sharing all of your wealth of knowledge and expertise and advice. We are going to put some resources up on our website and on the socials, so please just do send us those across so our listeners can make sure that if they've got any questions, they can get in touch and they can access those resources. Thank you so much. It's one of those things that for me is just really, really powerful, because like you said earlier, Jenny, it's really important that we talk about it. So thank you so much. And do you know what? Thank you for listening. Again, hit us up at The Beat 1036 FM on Facebook, Instagram and Twitter. Afrobeats is next.